This podcast, including all discussions and examples, is for informational purposes only and does not constitute professional advice. The views expressed in this podcast are solely those of the host and guests and do not necessarily reflect the official policy or position of any government agency or company. Today, we sit down with Joel Barthelemy and Sam Price from GlobalMed to explore their telehealth innovations and discuss how their team delivers critical care solutions that support the warfighter anywhere it's needed. This is from the Dive Shop.
Joel, Sam, welcome to ADS. Thank you for coming out here today, being on our podcast.
Thanks for having us, Patrick. Appreciate it.
Absolutely.
We're real excited to have GlobalMed here today and learn a little bit more about what you all are doing in telemedicine. We had a couple conversations right before Christmas. God, like such neat stuff, excellent stuff. But I really think the best way to get this thing started is, Joel, you're the founder. Thing that struck me, serial entrepreneur. So why don't you go ahead and get us started with how you came up with GlobalMed and what you all have been doing?
Sure. Thank you, Patrick. Honored to be here. It was kind of forced into GlobalMed as what I was doing prior to GlobalMed in the late 1990s was high tech and educational studies with technology and video, and also semiconductors and video. And so when the dot-com bomb happened, that many of your audience may remember, but some others not, it was very difficult to figure out what I was going to do after the dot-com bomb and then 9/11, because pretty much shut down my business. And so I had a factory in Phoenix to do semiconductor repair and semiconductor quality controls for Intel, Motorola, Avnet, and others. And I also had a camera company for video conferencing. And
it's like a little bit of everything there.
A little bit of everything,
yeah.
Truly. And so when that all happened, I found myself in a 25,000 square foot building all by myself and 100 and some people gone. And so I tried to figure out what would work. And so our technology really fit better within something that was more technical for the human. And so I had met a physician from Tulane, and he was like, let's use your tech and your software for pathology. And so we started in pathology, and that was a long time to try to get a business together in that area. And one day I was talking with my dad, and he was talking about going to the VA again. Well, we lived 1.5 miles away from a VA in St. Cloud, Minnesota, and a beautiful 9-hole golf course. He loved going there and meeting with his buddies, World War II vet. And but then he would get on a bus at 7 o'clock in the morning and drive 2.5 hours to Fort Snelling in St. Paul just to have a hearing test.
Oh, wow.
Yeah, so
it's quite the haul for the hearing test.
Right.
Yeah, quite a haul. But then he would be there all day and then get back on a bus late in the afternoon and go back to St. Cloud. So a 15 to 30-minute visit for my dad was actually around 10, 12, 14 hours. And he never complained about it, but he saw what we had been doing, and he's like, it would be really good if I could show what you do to the docs at the VA. And so that's pretty much how this company started on the path that it is now. We left pathology and went into general telemedicine and do a great deal within the audiology space as well.
Okay. And as you were saying, sort of that earlier portion that the pathologist got interested in is you were looking at, you were using the cameras to inspect equipment, and that really gave you that initial concept of saying, look, I can do diagnosis with a camera. And from there, you're able just to build it out into a much broader medical sense. Can you tell us a little bit more about that?
Sure. So, and I kind of skipped over that. So when we had multi-million-dollar equipment to work on semiconductors, if one of those machines dropped down, our throughput of devices that day would be severely hindered, and our customers would possibly get delay if we couldn't handle the throughput. And so what would happen is we were in Phoenix, we would have to get a technician from Dallas to come in fly in, check the machines out, figure out what was wrong. And if he didn't have the right technology with him to fix the machine, we'd have to wait another day to get that part. Well, that really did hamper us. And so I had that camera company that was a small little camera that I was able to put down into the machine, and another company I had invested in was doing, and this is 1999, 2002, in that area where I invested in some companies where they did video conferencing, not with a Polycom or PictureTel. They did it with a Mac laptop. Unheard of, but the Mac laptops could truly handle the throughput of the data, and our camera worked perfectly with it. So I could take the camera and go down into the machine and grab what was not happening correctly and video that to Texas, and they could see and actually send the part to me immediately. I would have it the next day and have one of my techs on site replace that part. That changed our business. And so when I had shared that with the physician, he was like, well, that's what we need to do in healthcare.
Yeah, I mean, that's great. I mean, that's bringing doctors to the patient rather than the patient traveling to the doctor. And you
Yes,
see in
sir.
that efficiency that you're able to create there, the ability to get work done right away. I mean, that's excellent. Well, Joel, thank you for that. That's great. We're going to move over to Sam. You know, Sam's coming at us 20 years in the Air Force, got out looking for that thing to do. Talk to us a little bit about meeting Joel.
Sure.
and how that went and your role at GlobalMed.
Sure. So the departure from the Air Force was sort of not exactly on my timeline. I ended up with some medical challenges and was medically retired, kind of off what I was hoping to do. So I got out. I was lucky enough to get picked up by a government service and started working in the government for a couple of years and met some great people along the way. One of them was this real fireball of an Army physician assistant. And he, when I left the government, he goes, you need to call this guy, Joel. You guys are forward thinking, you're creative, you're problem solvers, you should give him a call. So I called Joel and I said, listen, I don't exactly know what you do, but our common buddy recommended I give you a ring. So we talked for about an hour and a half. And at the end of the conversation was, I still don't know what they do, but what a great guy. I mean, he's a Marine. He'd served his country. Here he was trying to solve problems today, which I still didn't understand, but a family guy. And I'm like, this is somebody I can really relate to. He goes, hey, how about you give me a call next week? So we had another conversation and I started to learn more about what GlobalMed did. And the more we talked, the more I started going back through my personal life as an operator in the military and saw some of the challenges that we dealt with trying to get access to care when we were forward deployed in austere locations. And suddenly my brain started racing about, man, we could be doing this so much better. I thought about my experience with VA healthcare and how that could be greatly improved with telehealth and all the other locations and places. And suddenly it was like, man, I really want to be a part of this. So Joe goes, great, you're going to run my government office, go build me something in DC. So I quickly called the super friends together. I've got a young former corpsman who I'd known from a previous life. He came over to work. We brought in a former Army infantry medical logistician. We now have a former Army helicopter pilot / Coast Guard pilot. We've got this very, I hate to use the word incestuous, but really incestuous family up here in Virginia where we run this office out of. And Joel's been kind enough to just say, hey, listen, let's go out and help people solve problems. And so that's what we've been doing for the last 5 years. It's been great.
Well, that's great. And it sounds like you have a lot of operational experience in that team as well.
We really do.
And you're using that to leverage now building those government and relationships.
Yeah, absolutely. And that's, you cash in on friendships to open doors and have conversations. But really and truly, it's understanding where you came from and understanding the challenges you dealt with along the way and understanding the solutions that this company can provide and helping people get to that aha moment of what really could happen. And it's fun. I mean, when it happens, it's really exciting. You have that collective light bulb that goes off and everyone goes, geez, I never looked at it that way. We really could solve some problems. And so it's exciting. It's fun. I know we're helping people get faster access to care, get to work with great folks along the way. So it's been a great transition for me for sure.
Oh, that's great. And you both mentioned the VA, and I've got some experience with the VA as well as a veteran. And it's just, I'll say it's great healthcare. When it's on, it's great. but when it's off, it sometimes just feels like a miss, and but you all are now in VA hospitals. You're able to bring that telemedicine technology. Can you talk a little bit about that as well?
Sure. So we started with the VA back in about 2008. So the technologies that we were using on semiconductors was reinvented for healthcare. And then we took and designed a camera that allowed for, versus a little ball camera, a camera a little bit bigger than a dry erase marker that allowed for a medical tech, a nurse, a doc, whomever, to take the camera and actually put it on the part of the body, or put a device on it to look down the throat, or put a device on it to look into the ear, and so on. So we created that technology, and the VA in 2008 or 9 purchased like 7 cameras from us. And I met the national director of healthcare for telemedicine at the VA. And I said, so what are you going to do with the cameras? How are you going to use them? And he said, well, we're going to put them on our carts. And I knew the cart that they had, and it wasn't a cart. It was basically an IV pole with all these baskets and cables. And I was fortunate enough to work with a doctor from Chicago, the Children's Hospital there, and she helped me design for her needs a cart system with our software to allow for her to have intensivists see infants in the neonatal ward.
Oh, wow.
Yeah. So I had a design of a cart system with the software and the camera, and I took that to the VA, and I really met most of their needs and desires, from the nurses not wanting to have to push a heavy cart or go down what they would call a death ramp that was too steep a slope. And so we designed a system for them that really worked. And they now have, I think, 2,300 systems.
Somewhere around there.
Yeah, so
that's a pretty big jump from 7.
It is.
Yeah, that's great. That's got to feel good knowing that you've really, opened up that care to so many more veterans.
And Patrick, that's really what it's about. And it's we're a company that is privately held. We don't make huge profits because we really put everything back into the people and the technology, because our vision, our mission is truly not about making the next sale, throwing money in the bank. It's really about how can we have as much impact on patient care. And being veterans, it's really important to us that we take care of our veterans. And so we continue to move the ball for the VA, for our active duty members in DHS and our military, and across the world. So it's not just government business. We do a ton of business inside. Like we're working on a project right now in Ghana, and a very huge project to help the people of Ghana. We've done Cape Verde, the islands. If anybody realizes where the furthest west nation within Africa is, the Cape Verde Islands on the northwest coast. There's 10, 11 islands in there. For years, if you were sick on one of the islands, or what I love the story about is women that were pregnant never had prenatal care. Because if they were on one of the outlying islands, to get 7 months pregnant to come across the water or to get on a plane, it was only in dire emergencies and sometimes not at all. So we outfitted all those islands with our systems. And so now, and actually this was probably about 2015, the first time ultrasound was used remotely on the islands, changing the dynamic of care in women's health and across the board. So go ahead.
So what I love, right, what started as a camera for telepathology, right, passing blood samples, quickly became, dad saying, well, geez, what else could you do for the VA? And so over time, you find partners who create different devices, and we've integrated them into our software. Whereas today, cardiology, pulmonology, otoscopy, ophthalmology, you name it, the portfolio, what's in the art of possible, continues to evolve. So we went from these carts where I can go into a clinic as a veteran. I can go into a clinic. I don't have to make that 2-hour drive into the VAMC. I can get my specialty care because I have that reach back capability between those 2 points. So now the VA can concentrate specialists at the medical center, and focus on primary care and telehealth clinicians at the outlying clinics makes for a much more efficient program. But the really exciting part is they were like, well, if you can do it in brick and mortar, where else could you do it? And you look at the advent of where cellular technologies come and now LEO satellites, realistically, we can do care from anywhere. And we're really pushing the boundaries. Cape Verde is a great example. Oil platforms off the coast of Brazil is another one. And we were talking earlier before the show started about helo lifts back and forth. They're unsafe. They're expensive, right? It's operational impact. The minute I take someone off that oil platform, I lose them for the duration. So how do I improve operational effectiveness and efficiency? I keep that person on that platform by bringing care to them. And so our solutions went from being, we still have these, right? Cart and wall mounted, but portable. We have cases and we have backpacks now, same devices, same software, but now it's portable. And through a satellite connectivity or cellular or Wi-Fi, I can do the same exact thing I was doing in those outlying clinics from anywhere. Boat with a goat is my running line, like to quote Dr. Seuss from time to time. But so that's really where we're pushing boundaries.
Yeah, and so you're really looking at it as, the foundation is within brick and mortar medicine.
Right.
But now that transition into the, operational medicine, like you said, get out to an oil rig and now all of a sudden all 10, 15, 20, workers out there have access to whatever healthcare they need, whatever medical care they need.
Right.
And, you did make that good assumption. It's like guy thinks he's really, really sick, finds out like, hey man, you got to stay away from the lasagna night. It's going to be okay. But you don't want to spend, a couple $100,000 getting them off, losing it time, bringing them back, things like that. And that's great.
Right.
How are you seeing that now with the Department of Defense as a customer for operational medicine? I know at Warrior East last year, and I believe the year before as well, you all had some stuff set up where you showed like, look, we can show you here's where a surgical team could be working on someone, but have a, vascular surgeon expert back at Walter Reed kind of guiding them through that.
Right.
I'm sure that's a big help, especially downrange.
Our medics and corpsmen that are in the military today and our technicians are fantastic, highly trained, highly skilled, highly professional young men and women who are out there forward. And we've got them in the tens of thousands around the globe, right? So they're out there, high resource, low density are the specialists, emergency docs who are back. We can connect them through this telehealth platform. And so what I can do is push that power, that the experience, that know-how from that high-end provider back at the hospital out to the field. And so now I can take that medic and they can kind of become the eyes, ears, and hands of that remote provider. And so maybe I'm not an ultrasound technician, but I know how to use this handheld ultrasound. I know how to use the software. And they can watch me as I'm doing it to make sure I get the right image that they need to make a decision. We call that telementoring. And so, there's a lot of enthusiasm. In fact, one of our teammates is down talking to one of the Army units today about how they can use this for forward deployed, everything from occupational health to sick call missions. I mean, really, it's endless. I mean, there are challenges, right? So depending on the environment that they're operating in, they may not have the bandwidth they need. But when they do have the bandwidth, it's really a force multiplier. I don't have to relocate people, and I don't have to bring quite as many people forward. So there's a lot of efficiency that can be gained by using it. But it's not just the DoD. You look at what's going on in border operations today for the U.S. You look at what happens during a disaster. Right? A hurricane comes in and wipes out hospitals and clinics. You can't relocate everybody to where healthcare is. You bring the healthcare to them. One of the more exciting things we've got going on right now, and I'm really, really stoked about this, is this portable mobile medical unit. It's 8 feet tall, 18 feet long. It's about 1.5 feet wide. Comes in on a trailer. You hit a button, it unfolds into a mobile clinic. It's got HVAC. It's got sinks.
Like a transformer.
That's right.
Just comes right in.
It's a really
looks
cool
like a
show.
box, turns into a hospital. Yeah.
Right. So now I've got a facility that I can set up in an environment, protect people from the environment, and I can put multiples of these up and run clinical operations in a disaster or austere setting using telehealth for that reach back, using SATCOM for that communication, right? Use a generator. So it's great having a partner that has a full catalog of things to augment.
Yeah.
A little bit of an ADS plug.
Right. Well, thank you. Thanks for the plug. We always appreciate those. But you're right. That ability to really create the force multiplier. You said it before, soldiers, sailors, airmen trained in medicine. Like they know the TCCC, that everyone's getting is a lifesaver. We've got physician's assistants that are not at the front, but one step back. And then, the brick and mortar doctors and surgeons that aren't just always going to be available to be deployed downrange.
Right.
And the ability to get that kind in theater, be able to get the support that they need is incredible. And disaster response as well. I mean, we've seen that even here in the States where things happen, you're just like, they tell you there's just not enough doctors and nurses to help all the people. So that's great. One of the things that we talked about also earlier was like the ADS GlobalMed strategic relationship. So now we're kind of moving out of brick and mortar. When it comes to operational medicine, we think about like, well, where's the next great conflict? There's the great power conflict everybody talks about, whether it's, Russia into Europe or China into, really anywhere in the Pacific at this point. But that creates a lot of far-flung installations. We have some of them already there. Guam, is kind of the one that first sort of jumps out. But we're talking about, now there are installations all over the world. There are places. Some of them are temporary. Some of them are more hardened and permanent. But again, stretching thin the ability to provide care. That's where I'm interested in, and I think our listeners are interested. How do you see operational medicine getting you past that golden hour? Because it used to be like, it was like the golden, 30 minutes, right? And then it was the hour. And then they're getting to the point where it's like, hey, look, like we can keep a soldier alive, or, we can keep a soldier stable for like 4, 5, 6 hours, but we got to get them out. We got to get them out. Now, there's potential that in some cases, you're going to have to keep them stable for 24, 48 hours because, it's not going to be like, hey, we're back at the FOB. We can get a bird in here. It's like, hey, we're back at the FOB, but it's, denied airspace. And that's I think the thing that's going to be the big kicker.
That's the catch right there, right? So denied airspace is going to make things challenging. Denied sea lanes communication, that's going to make things challenging. As long as communications are up and running, we're going to be able to do exactly what Joel was talking about earlier, right? That reach back, telementoring support. Is it perfect? No. But can I augment what that medic or corpsman already knows? Yes. And so I think that's where the direction of this is going. Things where we can help today, we can empower that telementoring for sure. But even more importantly, when you left and you went over the VA, what did your record look like?
Oh, it was pretty blank.
Right.
Yeah, it was like, first day.
So the thing that I'm really excited about what we do today is digital acquisition, right? Lots of folks talk about telehealth. And telehealth to most people is I open up FaceTime, I give you a call, you give me a call, I can see you, you can see me, maybe you're sweating, maybe your face is red, maybe you have an arrow sticking out of your head. I can only do so much in the diagnosis piece. With our version of telehealth, it's data, right? We're pulling vitals, right? We're pulling in those digital cameras Joel was talking about. We're putting a 12-lead EKG on you, and that data is flowing across. That ultrasound, I can see it live, or I can capture it and I can pass that data back. But in all cases, they're discrete pieces of medical evidence. And that medical evidence is now yours. That's your record. So the next time you go in, I'm not starting from scratch. I'm doing a side-by-side comparison. So, lots of us spend a lot of time outside in the sun. Moles are a problem. I can now measure that mole on day 1, and then I can measure again at month 6 and measure it again at month 12. And I don't have to make you come into a dermatologist. I've captured the data. They can see it live. So it's things like that. And at the end of the day, when you make that transition from active duty or reserve or guard and you go over to that VA care, your record should be seamless. And that's what we're trying to empower with our system as well. So telementoring, digital data acquisition from forward deploy, that's where it's really going to help. You talked about Guam earlier. It's $3,500 to fly someone from Guam back to Hawaii to get specialty care. That's one person. So now if you have to take little Billy with you, that's $7,000, right? So the math is just crazy and it's unsustainable. Whereas with technology, we can help do that care from where the patient is. And, Joe, you mentioned rural earlier. I hate to jump the shark here on the OpMed thing, but
no, it's
rural health transformation, I don't know how much you guys are tracking what's going on, but there was a massive investment by the United States government in trying to support rural health in America. And those same concepts, those same ideas that we're talking about right now are happening all around this country, right? There are people who live 2, 3, 4 hours from a clinic or hospital because it's unprofitable to maintain that clinic and hospital. So I'm going to push it to the urban centers, and now you get to drive to it. So good luck taking off an entire day's worth of work to try to go get care. What we're trying to do is push that care back out to where those folks are so they can get it in a timely fashion. So the 3 pillars, I think, we walked by your guys' pillars out in the hallway, but the 3 pillars, I would argue, right? It's faster access to care, helping people drop costs, and improve patient outcomes. And that's really what we're trying to do.
Yeah, that's excellent. We talked about it last year. You guys called it the technology brings equality to healthcare. And I think that's something, I mean, that's like, I hope that's like kind of like just right under GlobalMed, right there. That's a great tagline though on it, because that is exactly what it is.
Should get that right.
Yeah. But no, that's great, because that's really, you know, where I think you've really set a standard now for care, where it shouldn't be that, like, because I live in Virginia Beach and I can go to Centaura, I get better health care than, you know, even the folks that live out in Suffolk or, you know, in the more rural parts of the state of Virginia, right? Like, they should be just as good for the health care, you know. They should have a place they can go to. I mean, you still go to the post office just about everywhere in America. It'd be nice if you had a clinic there too, you know.
That's a really great point.
So maybe we put those there, use those buildings. I don't know. So going back to the ADS strategic relationship, right. You know, you all already had some experience with one of our category managers, Chris Perry. Can you talk a little bit about, you know, how you all were introduced to Chris in his previous life in the Army, and then back, you know, what you all are doing with him today?
Sure. So I was working up at the White House to help set up the systems for the White House Medical Office back 2015, 16. And somewhere along the way, I ran into Chris that was on site and looking at the technology. And so great guy. And it was just so wonderful to run into him again through this organization. I didn't know he was here at ADS, and a mutual friend had said, hey, you need to talk to Chris. And so it was really nice that we got hooked back up again. And so it took us maybe a few months to get rolling here and get our small company approved by yours. And since then, it's been an absolute wonderful journey. You've got so many excellent people at ADS, and that's who we want to be associated with and who we want to work with. And so we talk about partners in our business, and ADS has become just a solid partner of ours. We wish more of the people in this industry work so well together, but we certainly are enjoying, and you guys are visionaries. So sometimes we think about something, and this is how we're going to handle it. And your team is so well experienced, Chris included. It comes back and says, "Well, what if we approach it from this angle?" They've been in the trenches longer than we have, and so it really is quite a blessing to us as a small company.
I really appreciate it. You know, we try really hard on that. You know, we want our suppliers, you know, that we're working with, the vendors, to really trust us and have that relationship that really leads to great things. So speaking of great things, what do you all have planned for 2026? You know, new year, new you all. What's it going to be?
I won't give specifics because there's nothing in writing, but there are a lot of great opportunities, right? So everything in our business takes time, right? So we don't sell pencils, so it's not like there's that immediate gratification of, hey, here's your dime, give me my pencil. It takes time to get people to wrap their heads around what it's going to take to have an enterprise, you know, digital health solution in their organization. It takes time for them to recognize what they're going to have to do internally, you know, line up budgets and so forth. But we've been working pretty hard for the last couple of years, and I think we've got a couple of good opportunities that are going to pop this year. So really excited about it. And a lot of that, back to what Joel was talking about, comes from those relationships and partnerships and so forth. And if I can backtrack just a little bit, I had never met Chris. I met Chris purely because of, hey, Sam, I want you to talk to this Chris Perry from ADS. And you would have thought we had known each other for years. And I would say
that's great.
That's our running experience here, is that everyone's like, it's like, hey, it's cousin Sam, right? He's part of the family. And so I can't say enough good things. Joel and I talked before the holidays about that important partnership and knowing and trust, and that they're going to be standing next to you. So I'll tell you a quick story. I had back surgery in May. I was a train wreck of a human being at Warrior West. I mean, it was all I could do to get down the hallway. And we got invited to go do a presentation for CENTCOM in San Antonio, and really exciting opportunity. But it required moving a lot of stuff. And so I was able to grab one of our product managers from the headquarters to come out and help me, but we were shorthanded at the time. And Chris dropped everything he was doing, drove from Houston to San Antonio, and in 100-ish degree weather is like throwing boxes, throwing cases, just that's when I say teammate and partner, that's exactly what I'm talking about, is a Chris Perry who drops everything to be there when you need him. And it meant a lot to me. I won't forget it. So.
Oh, that's great. I'm sure he appreciates it. And, he'd probably drop it all and do it again if he needed to, right?
Maybe not the whole thing, but yeah.
All right. Well, gentlemen, I really appreciate you coming down and talking with us today. It's been great to learn a little bit more about GlobalMed, get to know you guys a little bit better, and hear about what you got going on in 2026 in the future. Really appreciate it. And thank you for coming out. Any parting shots? Any last things?
No, it's just an honor to be here. Thank you, Patrick. Nice job. And we really look forward to doing more with you.
Yeah. Outstanding. All right. Well, thanks a lot, fellas. Appreciate it.
Thank you very much.